may seem high, but in real terms, you know, that money comes back to the government. So I want to plead with the committee, when we come with these legislative requests, to please support us and please support the local manufacturing sector so that our people can also be the participants in supply of KEMSA. I submit.
Thank you, CS. Allow me, members.
He left one, sorry to interrupt you, Chair, sorry.
Honorable Kagwe.
He left one issue of the chairman of the Chamber of Commerce doesn't want to appear before us. I had asked about that comment.
I cleared that, Honorable Kagwe. I said that my understanding is that the chair had said that he is coming.
While at it, Madam Chair, maybe if for whatever reason it is found that there is impropriety at KEMSA, Honorable CS, isn't it time that you send the entire board packing, the board members of KEMSA, other than just the CEO? They were innate together.
Honorable Kagwe, that's an additional question. So I'll hold it. CS, you can take some water. Okay. I want to give it to the PS. Stop.
Are you with this committee?
I am with you, but that was an additional question, and I had already made a ruling that we'll still take more questions. The CS is not going anywhere. I think it's important he takes just some water, and I give it to the PS to do her submission. You can proceed.
Thank you very much, Chair and honorable members, and thank you for giving us the opportunity to air on some of the issues that have come out in a very controversial manner. Chair, we'll start with the background that we have provided here. And first, Chair, maybe perhaps to refer to your letter and the information that you sought from us. You wanted to know by the letter of 1st September the role of the Principal Secretary and the Cabinet Secretary.
And speak to the microphone, or you can shift if the microphone is not clear. Just hold the microphone up so that we can hear you properly.
All right. Is that better? Okay. So I remove the mask, maybe. It's so hot. Okay. Let's keep it. So, honorable members and the chair, through the chair, there are 3 questions that we are expected to respond to, and this is as communicated by the letter of 1st of September. Chair, let me begin by responding by giving a bit of background that in its oversight role to the Kenya Medical Supplies Authority, the National Assembly Department Committee of Health has commenced investigations into claims of alleged misappropriation of COVID-19 funds, irregular procurement process, and other related issues. And so it is in this regard, as I said earlier, that the committee, via their letter of 1st September, invited us to answer to the following questions. The first one is, as I said, the role of the Principal Secretary and Cabinet Secretary in the 758 million and 7.1 billion procurement, and as follows. On the 758 million, Chair and honorable members, which is part of the 1 billion, which was provided by the World Bank, the Ministry and the World Bank jointly agreed on the budget and the procurement plan based on priority areas in mitigating COVID-19. The Ministry subsequently formally requested KEMSA to undertake the procurement and delivery of commodities to national and county facilities. With respect to the 7.1 billion, the Ministry has no role at all in that procurement because these funds are related to the KEMSA capital funds. The role of the Cabinet Secretary in this matter was to provide policy direction for the bilateral support from the World Bank. And with respect to the Principal Secretary, the role is to, number 1, requisition the funding from the World Bank. Number 2, make requests to KEMSA to procure items on behalf of the Ministry based on the needs analysis and available resources, and there's an Annex 1, which I will come back to. And finally, based on the needs analysis, give the distribution instructions to KEMSA for the procured commodities that are funded through the Ministry of Health. Chair and honorable members, allow me to go to to turn to Annex 1, which is attached, so that, Chair, we can walk you through how we have managed and prosecuted the procurements as relates to the 758 million. Chair, on 18th of March, as you can see in the attachment, we gave instructions, or we requested KEMSA to undertake procurement of those following PPE items, N95 masks, and some laboratory sample transport collection consumable kits. And Chair, this was followed by specifications, which were then later sent to KEMSA. On 19th of March, and again, Chair and honorable members, this is when we had the very, very first cases of COVID being reported in the country. On 19th of March, again, following a meeting that had been held with the laboratory team and the resource mobilization team of the National Task Force for Coronavirus, a decision was therefore made to procure commodities for COVID-19. And it was in this regard that, in addition to the request we had sent in 18th, that we required to procure 6,000 laboratory test kits, which included the laboratory supplies and reagents. And the Chair and honorable members, that was provided for, again, as we instructed the KEMSA to procure. Again, on 23rd of March, the ministry again wrote to the CEO of KEMSA, and again refers to the National Emergency Response Committee on COVID-19, which had met on 21st of March, and where it was agreed that there was an urgent need for us to procure 30 ventilators to serve both the adult pediatrics and then also universal disposable tubing and accessories. And we also gave an estimated cost of what was, said to us would be the price. And so we also noted to them that this was needed for purposes of the intensive care unit services in response to the emergency. And in this respect, we really asked them to procure urgently so that this can be distributed to the counties. Chair, following that request by the ministry running from 19th, 18th, and 23rd, I then sought to be given the status of the procurement at KEMSA. And Chair, I must note that there was quite a bit of communication, and eventually the Chair was able to get us to receive this information. And so, Chair, if you note in the communication that is via email from KEMSA, they are submitting to us, as you can see from their email of Thursday, 2nd of April, that the total, the emergency procurement status as of 2nd of April of 2020, and also their planned procurement of the ventilators and the planned procurement of the lab commodities. And Chair, if you turn to the next page, you will see that the communication that came through, actually it was 2nd and on 1st, and this case, in fact, the 1st of April, communication had already been sent to us. And Chair, as I submit this email communication, I want to confirm to you that the World Bank considers emails as official communication, and I also sought guidance from the Auditor General's office, and I'm told that comfortably that emails are also official communication documents. So you can see that as of 1st of April, the KEMSA had already undertaken a procurement of 2.1 billion worth of commodities. And out of that, they were indicating that they have received 149,000 worth of that. So, Chair, if you go further, you will notice that they gave me a detailed report on what they had already procured as of 2nd of April and 1st of April. Chair, in this document, which is listed and has got very small print, there is the first column there which talks about the numbers, of course, how they are arranged. The second column talks about the item description. So these are the items that the ministry had requested to be procured. They also had the unit of measure, whether this was by pairs or by pieces or by any other unit that was relevant to the respective items. Further, they also indicated to me the suppliers. You can see there, they have listed all the suppliers who are being contracted to procure these goods. And Chair, as you move along, you notice that the unit prices are also provided and the quantity against each company. And also you see the total cost, Chair, which if you follow through to the bottom, actually comes to 2.1 billion worth of goods. So, Chair, it's important for you to note that this document came from KEMSA communicating the status as of 1st of April. So when I received this, and Chair, I would want to assure you that I had had several communications trying to get this information, I called for a meeting between KEMSA and us to just discuss about the World Bank procured items. And when we met, Chair and honorable members, I requested KEMSA to rationalize the budget because they had clearly gone way beyond what was expected to be spent. And again, you can see through the email communications that are shared between ourselves and KEMSA, and even KEMSA writing to me, because they write to me on the I think this is let me just confirm. They write to me on the 7th of April, and the commercial director writes as follows: Dear Madam PS, I refer to the consultative meeting held at Afia House on 6th of April 2020 on the above captioned subject matter. As advised, we had to scale down the commitments to the budgetary limits guided, and I had given them the guide, and which is the 758. We shall be reviewing other previous instructions from your office on various procurement and seek guidance accordingly. So they also refer to the request that we had made. But if you also note on the same matter, the Director of Commercial Services attaches 2 documents, and in fact, to one of the officers in the ministry, and the document is attached there, Dr. Wangia, who is the project manager. He says now that they have attached the rationalized budgeted items. And you can see that, again, the emails are attached there for your appreciation. And then KEMSA goes ahead to basically attach the commodities that they had begun to procure up to the limit that we had given them, which was 784 and 700 and let me just refer very clearly, which is 758 million. So, Chair and honorable members, when they gave us these rationalized figures, and Chair, you can see all that KEMSA did was to reduce the quantities, but the presentation remains the same as the one that they had made on 1st and 2nd of April, which is the item's description, the unit of measure, the supplier, the quantity ordered, the unit price, the total cost. So it's a complete replica of their submission of 1st of April, but only that this time they have rationalized it to fall within the budget that the ministry had set, and which really we had funds for. So my biggest concern was that we do not make commitments beyond what is not available, because again, that would be in contravention with the public procurement laws and the PFM Act. So, Chair, following the receipt of this letter, I then now wrote to the CEO of KEMSA on 15th of April, now confirming to them that we have various items that have been identified and approved by the bank for the procurement of KEMSA, and now I was communicating to him that we have approved procurement of goods worth 758 as outlined in the attached annex. And we go further to say, disregard all the other requests made in relation to COVID as they have been captured under this approval. And Chair, why this was necessary, and honorable members, was because looking at what had been procured and what the ministry had asked for, actually the institution had gone way beyond the request. So at that point, it was just a question of capping them at 758 million so that we could be able to process that. And so, Chair, using the very document that they had submitted to me on the 7th of April, outlining the rationalized budget, I went ahead to give them the the approval. And so, Chair, if you look at the attached document, which contains the details of the order and which has been going around and claimed that the PS gave instruction, Chair, you can see that word for word, this is really a replica of the copy of the rationalized budget that came from KEMSA. So, Chair, this is to say very categorically that at no time did the ministry submit a list of suppliers from which KEMSA would buy. What the ministry did was to simply adopt the rationalized budget, because remember at that time we were in the middle of a crisis, but on the other hand, we had to ensure that we spent what we had available. Chair, going on further, just so that we understand the context at that time, on the 22nd of June, 2020, I received a letter from my colleague in the National Treasury. And my colleague makes reference, Chair, if you can read the letter dated 22nd June 2020, it's from the National Treasury. And it says that this is in reference to the letter of KEMSA dated 2nd June, seeking for budgetary support amounting to 5 billion to facilitate payment for the health products and technologies to cater for the distribution to public health facilities and other institutions providing COVID-19 related services. KEMSA has indicated that in consultation with stakeholders, it mobilized COVID-19 emergency supplies worth 5,140,946,000 with a view to mitigate potential supply shocks and far-reaching COVID-19 implications. However, we note that KEMSA has not provided information of whether the commitment was made without confirmation of availability of funds from the ministry. The above notwithstanding, it is noted that KEMSA has addressed this request directly to the National Treasury and Planning, therefore bypassing the Ministry of Health. KEMSA is advised that such requests should be channeled through the Accounting Officer, Ministry of Health. Further, since the National Treasury does not have any scope for additional funding, the ministry is advised to use the resources available for COVID-19 in the year 2019-20 budget. So, Chair, you can see now here KEMSA is coming to the reality of overcommitting, and now they have committed up to 5 billion. And Chair, I want to also be very categorical to say that this, the ministry was not aware of, that such a commitment had been made. And perhaps that's why the letter had gone directly to the National Treasury and not through the ministry. So, Chair, you can see there the next letter is a letter that actually had originated from KEMSA to the CS of the National Treasury, seeking for finances to be able to meet this cost that they had incurred of 5.14 billion. And they go on further in the attachment, Chair, to list the items that they had procured, all the way from KN95 face masks to the VTMs and all the other items that are listed there, totaling 5.14 billion. So, Chair and honorable members, when this letter was received at the ministry, I then wrote back on 2nd of July to KEMSA, and I made reference to the letter that had come from the National Treasury on 22nd June 2020, and here we noted to KEMSA again that KEMSA had sought for budgetary support from the Treasury to facilitate the procurement of COVID-related items, while these funds had not actually been provided for the funds were not provided due to unavailability of any scope for additional funding. But we also went further to note to them that through their letter, our letter, the ministry's letter, we had only given them approval to buy items valued at 758.690 million. And we also noted to them that through the National Treasury letter, the one that I have, another one of May 13th, authority to undertake procurement of health products under Global Fund grants to support COVID-19 response in Kenya valued at 517. Again, this was money that the Global Fund had given directly to the National Treasury so that KEMSA would be able to procure items. And then we also, I go further to tell them, to remind them to observe the authorities provided in the COVID-19 related items unless otherwise advised. Because, Chair, in my earlier letter, you have seen I've only given them concurrence on the 758 million. And I also raised the concern that has been raised by my colleague, that communications going to the Treasury must go through the accounting officer of the Ministry of Health, which in this case had been bypassed. Chair, if you go on further, you will see that on 6th of August, I've attached a letter. 6th of August, KEMSA writes to the ministry, and it's a long letter, but Chair, the bottom line in this letter is KEMSA is seeking for us to give them resources totaling up to 2.9 billion. First, they start by saying, one, they wanted us to convert the UHC funds, which had been provided for purposes of UHC, and the balance at that time was 6.7. They wanted us to use this money for paying for the PPE. So that was their number one request. Their second request was to be given additional financial support to pay for 2.9 billion worth of commodities that had already been delivered and not paid for. Chair, I then responded to them via the letter of 11th of August 2020, making reference to their letter, and be it also noting to them that they are requesting for additional finances, and I am pointing out to them that we are advising that the funds for universal coverage should not be utilized in the payment for delivered COVID-19 emergency supplies. And we also noted to them that the ministry was not in a position to provide any additional funds at the moment to cater for the delivered supplies. However, we told them and encouraged them to seek their own internal mechanism to address the cash flow management issue, and therefore advised them to take the necessary action. So you can see now there's a real attempt to try and secure funds for commitments that had been made. The question here is whether the board had given the approval, but I can say certainly the Ministry of Health had not given any additional request other than the one that we had agreed with them for the 758. Chair, I've just attached this letter of 27th of August, which was a letter addressed to the acting CEO, and this really was a letter that was in response to the allegations that had been made. They had been made here in Parliament that indeed we had given. In fact, I say this office, which is the PSA's office, had given names of preferred companies to supply COVID-19. And Chair, in this letter, I am reminding them, number one, of the instructions that they had been given from the ministry, which they had not even responded to by that time. Further, I also reminded them of the meeting that we had on 6th of April, which was then meant to ensure that they do not go beyond the thresholds, but we recognized that KEMSA had proceeded to procure goods in quantities that were way beyond what had been requisitioned in the 3 communications that I had mentioned above. Also at this point, Chair, we are noting to them that they had already bought goods worth 2.1 billion, as per their report of 1st of April 2020, and also, of which my request only had 149 million worth of goods, and that there was a balance of 2 billion, which they were yet to have paid for, but those were, the procurement that had exceeded the ceiling that they had been given. So we go on further in our recall the meeting of 6th again, where I had asked that they reconcile what was requisitioned by the ministry vis-a-vis what KEMSA had procured, which was worth about 2.1 billion. And it was at this meeting, again I'm noting here, that KEMSA was asked to rationalize the budget in order to align it with what the ministry had been allocated for PPEs. And subsequently, via their email, they had scaled down the procurement to 758 million. And the budget submitted by themselves had details of the items procured, their quantities, the suppliers were also noted, as well as the overall cost of the consignment. So I go on further to tell them that whereas there was an impression that had been created that the ministry had given KEMSA the list of the suppliers, it is actually them, KEMSA, who had provided the details while submitting the rationalized budget, as mentioned above. And so, again, here I reiterate my concern on the matter because I was solely concerned about the budget and had no intention at all to manage or to direct the procurement process. So, in the light of this, I asked them that if indeed they stand by the allegations that they were given the instructions by the ministry regarding which suppliers to procure from and at what prices, that they provide the letter that had been used to purport that my communication to them bore instructions as to where to source the items and the prices. And so for the avoidance of doubt, the only concern that we had as a ministry, was to ensure that the budget for the procurement was within the funds which were available for that purpose. And again, Chair, I had already referred you to an email that was written on 7th of April 2020 by Eliud Mureithi, who is the KEMSA Director of Commercial Services, and addressed to me, among others, confirming that the budget had been rationalized to be within the available resources. So I go further to tell them that they should note that it was after I had received the rationalized budget provided by themselves, which included the corresponding suppliers for each item, that I revised my earlier instructions to align the procurement to the budget rationalized by themselves, considering that the items were being procured on an emergency basis and the ministry needed to avail the funds to meet the cost of what had been procured under the instructions issued earlier on. So I urged them to trace and reflect on the sequence and flow of the relevant communication between the two offices and consequently put the record in the correct perspective in writing. So, Chair, I am awaiting their response, but certainly you can see the documents are attached here. They make reference to the emails that I had noted to you earlier, where they are writing, recognizing that they had had a meeting where they rationalized the budget to the 758 million. So, Chair, going back to the questions, because that one was in response to the question number 1. Now, the second question was about the status on UHC funds that have been transferred to KEMSA as at 1st September 2020. And Chair and Honorable Members, towards the realization of universal health coverage, amongst the key interventions was to ensure availability of affordable and quality essential medicines and medical supplies to all Kenyans across the country. Key policy documents were developed at the time to guide this intervention, and this included the revised Kenya Essential Medical List of 2019, the Kenya Essential Medicine Supplies List of 2020, and these documents detail the essential medicines and medical supplies that, 1, meet the priority healthcare needs of the population, 2, are safe, effective, and affordable, and 3, that are meant to be always available within our healthcare system. So in the third quarter of 2019-2020, that is January to March 2020, the national government provided a conditional grant to counties and the referral hospitals through an intergovernment participatory agreement which spelled out the allocation of medical commodities to each county and to the national referral facilities as drawing rights at KEMSA. And to respond directly to the question, the status of disbursement to KEMSA for UHC-related medical supplies is cumulatively at 9.62 billion. That is money that was transferred to KEMSA for purchase of various medical commodities for UHC, and this is as follows. The first transfer was done in 11 March 2020, and Chair, you can see, and honorable members, a lot of this money came towards the end of the financial year, 2019-2020. Another tranche was transferred to KEMSA on 30th of April, totaling 1.1 billion. And as of 11th July 2020, another 2.6 billion was transferred. And on 11th July 2020, 1.8 billion had been transferred. So as of 1st September, 9.6 billion shillings had been transferred to KEMSA specifically for UHC. And this is why, Chair, even in my letter to KEMSA when they were asking that they use this money for COVID, my advice to them was no, because it already had been committed for very, very specific interventions on UHC, and turning to use those funds without any approval from the National Treasury would be tantamount to going against the PFM Act. So in respect to the third question, which was the status of the delivery and receipt of the COVID-19 related items, I would wish to state here that the Ministry of Health has not directly procured any COVID-19 related items, and all the procurements have been undertaken by KEMSA in line with its mandate. Chair and honorable members, in our earlier submissions to you, we provided all the details of the utilization of all the funds that have been sent to the ministry with regards to COVID. And we articulated beyond the 758 million, all the other resources for HR, etc., and clearly outlined how the funds have been spent so far. So, Chair and honorable members, I wish to submit, recognizing also that this invitation was equally extended to KEMSA, and so I'm sure that they will respond to aspects of the questions that are very relevant to them. For example, where they are on the UHC funds, the utilization levels, and other issues where they may be the custodians of the information, and to just align ourselves to your direction that they too appear and present their perspectives into it. So, honorable members and chair, I submit.
Thank you very much for your submission, PS. I think from where I sit, my first question is, why were you communicating with the Eliud Muredi and not the CEO? I've seen a lot of communication is between you and Eliud Muredi. And at whose direction or authority did KEMSA procure above the budget? You've clearly said you told them not to spend even the UHC money. And maybe the question that will come, so what's the real expenditure on COVID with KEMSA vis-a-vis what KEMSA was supposed to spend on other items, including the UHC? I'll give it to the members. I've seen something written in the letter by Manjari that there was with consultation with stakeholders. Did you find out who are these stakeholders? It's okay, you will answer them. So, and do we have any more money, be it donor money, that is pending, that the ministry has authority to, for expenditure, either through donor or from the ministry, for COVID, or the COVID coffers in the ministry dry? And all this time, I was just thinking by myself, where was the board? You can see communication between yourself, CEO, the commercial director, treasury. All this time, did you either call the board or where were they? And maybe finally, the UHC money, I've seen it was given between March and July, just within 3 months. It's a lot of money, 9 billion. Have you found out whether it's still in the accounts, or has KEMSA used that money? And why did it take too long, towards the tail of the year? That's when the UHC money was given to KEMSA. I want to open it to members, and can see Honorable Koros, yes. Dr. Dahil Duale, Professor and Owino, or Captain Rueda. You'll also take the opportunity to introduce yourself as you ask your question, including Honorable Duale. Karibu. Yes, proceed.
Thank you, Chair. Thank you, Chair. So I want to ask something the PS, both the PS and the CS. What is the relationship between your two offices in terms of communication, consultations, and also, because I'm asking this because I've seen there have been a lot of communication between the CS office and KEMSA. But what I want to ask the PS, did you use consult the CS in all these communications? This also will arrive also to another question. Bwana CS, we saw after this issue of COVID problem, I mean the KEMSA problem when it was in public domain, we saw some changes, some restructuring in the Ministry of Health. We saw the president, he did some reshuffles, and then later on he halted the reshuffles. Bwana CS, what was your role in this? Were you the one who was advising the president for cover-up, or what was the issue? Madam PS, I wish this is the only court you have. It is like, after all, these COVID millionaires will still sacrifice you. You saw what had happened. If I were you, you better tell this court, this house, the truth. You could be knowing a lot of things. Madam PS, among these COVID billionaires, who did approach you or reach you for tender interference or tender favoring? Can you kindly tell us? Because we are seeing there is something between your office and the office of the CS. There's something. And somebody will be sacrificed. We want to know if there were clearly consultation between your office and the office of the CS. And if it was there, if it means one will be sacrificed, it's supposed to be both of you to go. We want to know clearly if there was clearly communication and consultation.
Your point is clear.
Chair, I think, yeah.
Honorable Koros, thank you very much. Professor, was it Professor number 2, or was it? I can come to Dr. Dahil.
Okay, thank you, Chair. First of all, let me introduce myself, Dr. Mohamed Dahir Duale, member of the Health Committee and also member of Parliament for the Dab constituency.
And I would request you put up your mask as you do your submission.
Okay.
Thank you.
Honorable Minister, first of all, I want to inform everybody that I was a victim of COVID, and I was in hospital for 42 days. Thank you so much. That 5 days I was on oxygen, and 7 days I was in ICU. So COVID is really real. And fortunately, my bill was paid by the Parliamentary Service Commission, but I don't know how many Kenyans will have the same privilege, because close to 4 million shillings was paid by the insurance which covers our service. So let me just go straight to the question. I thank the PS for the presentation. Madam PS, one thing I note in the presentation is that KEMSA was procuring things which they did not have money, according to the correspondence. Because the first thing they did was to write directly to Treasury requesting for funds, and the PS Treasury referred the matter back to you. And the 2-point-something billion, first of all, we would like to know, did KEMSA actually pay for that procurement, and who requested for them to procure those supplies? I also know that in the letter, there is information that they said they had instructions about who to give and so on. Now that information, of course, you had asked them to provide. But from your own, maybe there are some documentation which are not available. Do you know, were there other forces from elsewhere who are trying to force those people, and you might have that information, because it will be very important to know. Finally, to the CS, Bwana Waziri, I do know that you have talked about reform for KEMSA. We also have serious issues with the NHIF. I happen to have been here the last parliament and now here, and we have been talking about all this for all this time. You are probably the third minister who we are dealing with, maybe perhaps fourth minister, and it has been left at that point. Do you think that it will be possible for you to achieve a reform of those institutions in your tenure or in the next 2 years, whatever time, so that we don't end up with this kind of issue, because I think these are really related to reforms of these institutions, both of them, which we have serious issues of malpractice. Thank you so much.
Honorable Joyce, I'll come to you.
Thank you, Chair. I want to appreciate the PS for the elaborate submission she has made. And
I'll also remind you to put up your mask.
It's okay, Chair. For the elaborate submission she has made, and the flow, I think, is so clear to me, including the annexes. I've been able to follow them clearly. What surprises me, Honorable Chair, is the way KEMSA misled this committee, because that is the information that came to the committee, and it's the information that is carried out there in the media and in the public, that instructions were given as to who should be given tenders and at how much. It's now clear from the presentation made that it's KEMSA themselves that really initiated the communication on the proposal and the list of maybe pre-qualified suppliers that they had. And they again gave the rationalized budget as advised, and this is what prompted the ministry. That's to my understanding. And then the other thing that surprises me is the way KEMSA bypasses the mother ministry in asking such a huge amount of money. 5 billion is no small money from Treasury without the ministry knowing. One of the issues that is going out there is a company called KELG that is associated with senior politicians in this country. I've tried to look at the list given by KEMSA, although the prints are small, and we are told that FO is in the details, but I haven't seen that company. Maybe the PS could also shed some light if she's in the know of what really that refers to. Thank you, Chair.
Thank you, Professor. Mahmoud Mohamed.
Thank you very much, Chair. Thank you very much, Madam PS, for actually going through the detailed queries and questions and matters that we have raised earlier and you've responded to. But objectively speaking, investigations will go so far and painful. That must be known by Kenyans, and that must be known by the culprits, and that must be known by all public officers. And therefore, it is far worse than the messy mess that we have seen over the messy mess saga that we have seen over the years. It will be a relentlessly painful one on this matter, I swear. We are not yet out of the woods as per the COVID pandemic. But if you look at Table 1, which shows a cumulative expenditure of 9.6 billion already spent on UHC between March 11th to July 11th, 2020, it becomes obvious that we need to ask questions on this, that was about UHC. But can you tell us how much of the 9.6 billion was expended on the COVID emergency, other than the normal expenditure that you have authorized for UHC, budgeted, that is? Can you tell us what more funds are being expended and how much? That is under the COVID-19, under the UHC, anything related to COVID-19, if there is any. Because the cartels are still living. The result of the cover-up of COVID-19 looting by the living cartels still exists. So we must be treading the two thin fine lines, the UHC and the COVID-19. It might be unfortunate that Kenyans will know that we are not going to focus on COVID-19 only. We will focus on UHC. Let Kenyans know that we will not allow any cover-up by any cartels or anybody else out there. This is a very objective question. PS, tell us, you've told us that KEMSA is a different entity from the Ministry of Health. To some extent, you did. PS, tell us, who regulates KEMSA? Is it the Ministry of Tourism or the Ministry of Health? And as the accounting officer yourself, the Ministry of Health should definitely oversight KEMSA, I believe. And I will refer you with knowledge here. Gazette, Kenya Gazette, that is the 23rd June 2017 Supplement Act, reads, PS, can I bring to your attention, for the purpose of section 15, 1B, the Cabinet Secretary, of course you're not, but you are the accounting and the Cabinet Secretary also involved in this, shall form directorates to deal with the following matters: medical services, nursing, pharmaceutical services, public health, and administrative services. But that's not where I'm heading. I'm heading to B. That was A. B says, notwithstanding paragraph A, form other directorates based on policy priorities, areas in consultation with the Director General. I remain guided, but does it mean that KEMSA was actually established under that clause? Further, can I read to you, Madam PS? Read the KEMSA Act, October 31st, 2016, which formed KEMSA. That is KEMSA Act 2013. That must be read, and that must be explained well to us. The boundaries between KEMSA and the Ministry of Health. There are many Kenyans who are laymen and women who may not understand this, but we must read the law through the fine lines. Chair, I want to stop here, but I want to say something. You said that MOH has not directly procured any COVID-19 related items. KEMSA is a saga under MOH, and you are the Minister of Health. Does this mean hands off the wheel, and we are left to ride on the highway, or Kenyans are left to ride on the highway? Who takes responsibility for what? It is obviously this comes under the stewardship of yourself, of your office. And it is important that Kenyans are aware quite clearly that despite the thin lines, all should take responsibility for accounting on them. I will finalize, Chair. Treasury referred KEMSA to the MOH, especially as the accounting officer, meaning if you look at the letter dated 11th of August 2020 that you've written to KEMSA, CEO KEMSA, which you said that in this regard we wish to advise that funds for universal health coverage should not be utilized in payment for delivered COVID-19 emergency supplies, etc. Definitely, that brings me to a point that it becomes obvious to my mind and to my attention that obviously this letter was dated on the 11th of August, yet the agreement on procurement between the ministry and KEMSA should have started earlier, around March, I believe, or so. Why should a letter go after 6 months or so? I rest my case, but before I do that, Chair, the National Task Force for COVID-19 must be called, and they must come and tell us more about international donations, about the services that were done, and who was responsible for what. I appeal to the committee to call the National Task Force for COVID-19, because this will be a very painful journey for everybody on behalf of because of COVID-19, and who continue to suffer because of COVID-19. Thank you, Chair.
Thank you. I'll go to Captain Rueda, then I'll come to you, Honorable Wino. I can see Senior, I can see your hand. Allow me to give you at the tail end. Is that okay? I know you have been sitting for long, but because you're a friend of the committee, let me give Captain Owino, then I'll come to you, Senior.
Asante, Chairman. Kwa majina naitwa Captain Rueda Mohamed, County MP Lamu. Mwanzo ningependa kuomba msamaha, nimekuja kuchelewa kwa sababu nilitoka Kiunga jana, nilikuwa safarini ndio nimefika. Mimi nataka mwanzo kumpongeza katibu mkuu kwa wasilishaji wake mzuri. Ukiona tunauliza maswali, tunauliza kwa uchungu mwingi, kwa sababu kama hujaambukizwa na COVID-19 basi umeathirika na COVID-19. Hata kabla haijakuja Kenya, ilipoanza tu China, Lamu wiki hiyo hiyo wale lobster walitoka kwa kilo moja ni 1,600 ikawa 600. Kwa hivyo katibu mkuu alikuwa anauliza hizi barua, sijui kama mna system ya kuonyesha, manake hizi barua za zingine zilizoandikwa kutoka kwa KEMSA na katibu mkuu mwenzako wa Treasury, zote zimeonyesha kwamba kuna ile muhuri wa received. Hizi zingine zako zote ziko hapa, lakini hazionyeshi kwamba ulizituma kweli siku hiyo au ni zimeandikwa baada kutuletea tu hapa. Swali langu ni hilo tu, asante.
Owino.
Thank you, Chair. First of all, let me thank God for Dr. Dahir, who has gone through this experience and is here with us. Chair, this disease is true. In my constituency, we have just lost a very prominent person in 3 days because of the complications. It's no longer restricted to the lungs. It spread fast to the heart muscles. And people now drop and die without proper diagnosis. So that we are talking of a disaster here. But having said that, let me thank the PS. It couldn't have been more clearer than this, and that is why the meeting, so that Kenyans can get the truth, the facts as they are. It appears to me, in all this, you are sorting flies. But if, and I read it first, if the board was doing its work, then there will be no jumping to the Treasury, there will be no jumping here and there, because it appears to me, Chair, we are kind of dealing with a run-amok child here, who does things and then the ministry say, no, you can't do that. So what we are trying to do, CS, is, and it came from you, and I'm happy, we are looking on how we can plug off the lacuna, either whether it is in the regulations and policies or in the State Corporation Act, that can reform this. And remember, the governors are also crying, because it is here that we fought, and it was a heated debate, that we make KEMSA a one-stop shop for all medical supplies for institutions of government. And now the the governors are may have to relook even the amendment itself. And the other day, Chair, you can remember, I did ask whether KEMSA has still the capacity. We're talking of capacity of HR, how they run and all this, to continue to be main supplier. Remember, it evolved from medical stores earlier days, and that is what it used to do to the government. And now they have incorporated the business model, which could be also inhabiting greed and attitude of doing business more than the public good. So all this we have to wrestle with. P.S. I want to show you, maybe you don't have this document, but I'm just trying to say when the ministry sets policy or regulations, is it followed with? There's a document here which came from your office, and it's an old document. I respect authority to incur expenditure. Having worked with the government for a long time, I know it should be respected the way it is. So I read it for you, but you may not have it, but you will reflect on it. Number one, it was written on 16th of June about the 1.5 billion.
Honorable Wino,
which this House.
Where is that document originated
It was in the
from?
KEMSA.
Or from the submission of KEMSA?
Yeah, it was the KEMSA. That's why I'm saying you may
okay,
not have
well
it.
noted. And if you'd be able to refer, might be for the purposes of record, if it's an attachment 1B or annex. But if you don't have the details, you can still proceed. But I needed to know the document, the origin.
I know she don't have it, but I just bring it to, the point I want to make here is that it was 1.5 billion, which this House approved, because we believe that testing is key to know how aggressive this virus is moving around. Now, in the AIE, which you wrote and was prepared by Samson Ogalo, you said clearly that this being funds for procurement of test kits and reagents, which we approved for in this House to be done. Now, when it comes to implementation by KEMSA, they have added something which you can tell us whether was incorporated in that or not. They have 6 items. The 5 of them are testing kits and reagents. That one, I have no problem. But number 4, gloves, medium size, 100 packets, 1 million. See, what I want to bring to your attention now is the disconnect. You give an authority, and it is implemented the other way. That is why we are talking about reforms. Is it enough to give that, and when it is not done, what happens? Because if you ask me, gloves is not a test kit or a reagent. If it were to be included, then the PS would have also included in the authority to incur. And lastly, in that line, it says clearly how this is come. You will be held personally responsible if you incur expenditure without proper authority or excess of the amount cited. So it's a crime already if you do that according to the AIE. So CS and PS, what I'm trying to say is that we need to look where there's a problem. This is not just witch hunting, but to make this institution better, and also to make you sleep. I know you guys are not sleeping because you try to kill fires here and there, and it's quite a lot of work. And we look unto you on the COVID as well to give us what is going on. So lastly, I just want to say, if there is something you are seeing as a ministry that is making your work difficult with this agency, I think this is the time to pick them so that we can pick them up. There are also others which I have seen in the State Corporation Act, which we will look into as a committee, and if possible, amend them. Otherwise, thank you for a good job, PS.
Thank you.
For clarifying. Thank you.
Thank you. And I want to confirm for purpose of record on that attachment of KEMSA, it was Appendix 1A and 1B. Senior, Honorable Jimmy Angweni.
Yeah. Thank you, Madam Chair, for giving me a chance as a friend to ask 1 or 2 questions. One. Okay. One, could the minister or the PS tell us whether when KEMSA made a request from Treasury for additional funding, was the board involved? Was the board of KEMSA approve that request? 2, since it was communicated to the ministry that this KEMSA is trying to get funds through outside the system, outside the ministry, why did you leave them continue working there to make more messes? Why didn't you get rid of them immediately? You didn't have to wait for EACC or DCI to come and to ask them to vacate positions so further investigation can be done. And finally, I've seen that your tests have been reducing over the period in the last 1 or 2 weeks. Is it because you don't have testing kits, or is it because you have exhausted the people you want to test? Thank you.
Thank you. Yes, the CS and PS is your chance to
Thank you very
respond.
Much. Asante sana. Let me,
and so that we don't lose people, CS, you know you are a politician like us, so would like we summarize so that we don't lose the numbers.
I will summarize very quickly,
you.
Madam Chair. I actually note that it is going on to 6 o'clock. I will try very quickly. The first thing, I think Honorable Koros raised the matter of the relationship and whether the PS and the CS communicate in these things. The practical working environment, in a proper working environment where there is cooperation, is that the PS and the CS are continuously on all matters engaged and consulting perpetually. You can talk 3-4 times in a day. You know, it is a continuous engagement because this is the epicenter of the management of the ministry. So the level and quantity of communication depends on the environment, the circumstances that you are engaged in at the moment. Sometimes maybe you don't talk, maybe for a day, maybe the next day you are in a meeting the whole day together, as you can see what is happening here today. So I just wanted to clarify that for you, that it is continuous engagement. And generally speaking, if there is an issue of importance, the CS will obviously get involved. For example, when on the last matter that you are raising, on the matter of people wanting the direct communication between, KEMSA and the Treasury telling us, obviously we must consult. And on the basis of such a consultation, I will then tell the PS, cancel those things, all of them, which is exactly what we did. When those kind of things arose and we don't have clarity on them, we say cancel. We are not interested. We don't want to know. Cancel them completely. And Honorable Angwenyi, on that issue, or when you cancel it, then why not fire people immediately? I think that, as you noticed, if you look at the timings between when all those things were happening and today, quite a bit has happened. And one of the reasons why one invites people like the EACC is actually to build credibility and authenticate what is happening. Otherwise, what happens is that you then get accused of victimizing individuals. You get accused of all sorts of mismanagement yourself. When you're trying to build some efficacy between the decisions that you're making. On the matter that, first and foremost, I also want, where is Duale? He's gone. I also wanted to thank God for my friend Duale, because I didn't know that he was in such a state, and I'm very happy, and I'm so happy to hear that you have recovered. The last time we spoke, you are okay, so I didn't know where you disappeared to, but God is kind and God is good, that you are here with us today. It is because of his mercy and blessings, and we thank him. But on the issues that we have raised, on the matters to do with NHIF, on matters to do with restructuring, general restructuring of health, let me put it this way, Mheshimiwa, is that we are as determined as can be. We are completely determined. And the part of the fights that we are engaged in relate to the idea that these things must be reformed. Because if we don't reform them, then we might as well go home. We are wasting time. And I'm glad to report to you that if there is one institution which I can see going the right direction, it is the NHIF direction. But I'm also happy, and I thank Parliament, because the support of Parliament, you see, let's not forget how insurance works. This is an insurance company. Insurance works on the basis of probability of sickness of one individual. So the more people we have insured in NHIF, the lesser, the cheaper it will become, and the greater our ability to cover everybody in the country. Because UHC, which Honorable Sheikh is talking about, UHC, can only work if NHIF is working. Otherwise, it will be abused in a manner that you don't believe. So we have to introduce serious reforms. In the next couple of weeks, we are going to introduce biometric recognition of persons who are going to use NHIF. The reason being, then you can build data that can help you make decisions going ahead and that can reform the institution. But I can tell you that there's a lot of work currently going on in NHIF to restructure that particular health institution. Honorable Owino, I could not agree more, and I think the same theme keeps coming back. The issue of reforms at the NHIF. It has been requested by donors, it's been requested by Parliament, and I can confirm, Bwana Owino, honorable members, that this is something that we are working on. I just ask for a bit of patience as we do it, so that we do it also in such a manner that you don't do it and then you take 2 steps forward and you take 3 steps backwards. It's important for us to do it and do it holistically in an informed and structured manner. It's a management issue. And as for the governors, I think one of the reforms that is likely to come in NHIF, in KEMSA, is that this monopoly institution, the monopolization of every purchase, I think that needs to be reformed. And I have read the Act, I know what the Act says, but there are some things that do not have to be performed at KEMSA, that can be performed even at the county levels, provided that the oversight, even at the county levels, is just as good. And the directions that we give as a ministry include pricing, because on the other hand, you don't want to jump from the frying pan and then you go into the fire. But I agree with you completely. We have to reform it. The role of the board, I think that Honorable Owino had spelled out the board role very, very effectively in terms of CAP 446 and the other legislation items that you raised yourself regarding how we should relate. In terms of budget approvals are by the ministry. The running of the institution is by the board, and the board overlooks the management, what the management is doing on a day-to-day basis. But we must remember that the board chair is not an executive member of management. They are not executive members. If you look at the board, the Act itself, the board chair is a non-executive chairman, and that it spells out very clearly. So it is guidance, it's provision of guidance, provisions of decisions so that they make those decisions collectively. It's running the institution, but it's not in executive terms. It is in collective advisory terms. Madam Chair, on the matter regarding the decisions and the relationship between ourselves and specifically KEMSA, I think I've explained that, and the decision and the reasons why there was constant communication, written communication between the PS and the institution is because, as you rightly said, the PS is the accounting officer and has got to be careful, and we have to watch out on what is happening. And if you read the documents that you have, you will see the savings that were made because of that communication. You will see the decisions and the items that were done because of that communication. Otherwise, if we don't do that, it would have gone wild. I think the final thing for me to say also is that in talking about the board is also to remember that 3 members of that board are fairly new, and going forward, we will simply have to wait. As far as KEMSA is concerned, we will have to wait and see what they say in terms of the investigation results. And I think it's good for us to give them time so that when we make those decisions, we make them holistically. I thank you.
Chair.
Thank you.
Chair.
Yes.
Chair. Point of order, Chair.
What is out of order?
Chair, I think I'm not satisfied with CS answer to my questions. Because
Maybe
one,
if we wait
I
for
asked
the
him,
PS to
Chair,
respond, then it might be satisfied.
Chair, I asked him, one, the relationship between his office and the office of the PS. And Chair, no, if all the communication pertaining to procurement of COVID, all letters which originated from the PS office, was the CS aware? Secondly, Chair, I asked of the rumors going around that he is the one who was misadvising the president. Chair, please allow me to talk. And Chair,
time.
No, Chair.
I think
Chair,
it's sort of, let's him respond.
Allow me to.
And let's not dwell a lot on rumors here.
Yes,
So
I'm asking it.
let
Then
him
allow
respond.
me to ask the CS. The CS, what brought about the changes or the restructuring which was there in the ministry? And why was it halted? Kenyans want to know. Were you guys trying to do some cover-up, or what was the issue?
Madam
Yes,
Chair,
yes.
Madam Chair, can I start with the last one? First of all, Honorable Koros, you know we respect each other, and we like each other. But let me put it this way: matters and decisions of the president are not subjected to discussions with the likes of B. The president is free and in accordance with our constitution to make all those appointments. Who he consorts, who he doesn't consort, is a matter that I'm not privy to. Secondly, on the issue of my relationship with the relationship between a PS and a CS, I think I have explained that generally speaking, there are no decisions that are taken by the PS without consultations with the CS, unless they are of day-to-day nature, which don't need directives from the CS. Otherwise, why would there be two offices? There might as well just be one office and the person does it. So there are the day-to-day operations of the ministry in terms of the accounting procedures, in terms of all those things. Those are issues to do with the PS. On policy and strategy and so on, these are issues to do with the CS. However, the practical situation on the ground, Honorable Koros, is the same as you run in every other institutions. And communication, constant communication between the PS and the CS is a foregone conclusion. And I think that really settles that question. I thank you.
Chair,
Thank you. Could you
don't respond to my question.
Which one, Senior?
That they have scaled down testing.
Okay.
I'm sorry. Yes, it is true. It's true, Honorable Jimmy Angwenyi. It is actually true that the scaling down is essentially as a result of the fact that we ran two systems of tests. We ran a manual system, and we ran an automatic system, an automatic PCR system. Now, what is currently happening across the world is that because of the automatic testing system is based on equipment that gets reagents from America. The Roche reagents come from America. America, in the meantime, have placed an embargo on the exportation of any reagents, both on the Roche machines and the Abbott machines, because of their own domestic situation. Therefore, we have resorted now to manual testing. And manual testing is much lower, and manual testing, obviously, would take about a lot longer. So, whereas we have got the capability of testing a lot of numbers in terms of the equipment that we have very serious challenges of the supply of the reagents. And I know this because I have been on KEMSA the whole day, even before I came here, telling them we must look for these reagents so that we can continue testing. And this is why I was saying there is a formal There is a formal restructurings of engagements. But, you know, in a crisis like this, I cannot go to my office and write a letter to the chair to tell him, go and look for reagents. Neither can the chair tell me I'm non-executive, therefore, you know, I am not involved in that deal. These are things that are crisis management and things that bring all these things together in a rather informal and fast-tracked manner rather than just the formalities. So we are looking for those reagents, and as soon as we get them, then you'll see the upscaling of our testing. But let me also take this opportunity to say that when there is community spread, like exists now in Nairobi, then you will find that testing, while important in and on itself, does not actually give you necessarily the true figure. And when you look at the percentages, whether you test 10,000 or you test 5,000 or you test 2,500, and you look at the percentages have been consistent, almost consistent, which tells you that you can project that statistic onto the population and get a very good idea about the number of Kenyans who are carrying this virus. So we are working as hard as we can. We are facing that global challenge. It's not a Kenyan challenge. It's a global challenge. I submit.
Thank you. PS.
Thank you, Chair and Honorable Members. The first question, I believe, was about why I was communicating with the commercial director. Chair, if you look at the communication, the CEO is copied in all this communication. And again, you know, this is a crisis, and as long as we got the information and you know, there was that engagement going in, then really I didn't see anything wrong with that, Chair, because this was not communication that was done outside of the CEO. He was very aware. But this is the person who was literally charged with this work. So it made more sense, and because of the agency of the time. Then there is a question about who the stakeholders are that we refer to. Really, there is no, I don't know who that stakeholder is that was consulted, so I cannot speak for KEMSA on that one. Do we have more funds for COVID? I think, Chair, when we came here before you on the following your letter of 6th of August, we made our submission on the funds that are available, and Chair, we enumerated the entire allocation, and we also demonstrated to you what has not been utilized. So we are not dry. In fact, there is quite a bit of money that is yet to be fully committed and spent. And so, Chair, I would really wish that you make reference to our submission that was made following your request of 6th of July that you had asked that we share, and we did very comprehensively. Chair, on the issue of the UHC funds, I believe that that will be something that also KEMSA will be sharing with you, since they are also responding to this question. But we monitor very closely, and as you can see, most of the funds came towards the end of the financial year, and we believe that a lot of the items are also still under procurement, given that procurement is not a process of a week or a month. So typically about 3 months or 2 months, depending on the method that is applied by the agency. I think my CS has answered Mheshimiwa Koro's question about our relationship. We work very closely. I consult a lot. There is no decisions that are made without consultation with my minister. So we talk a lot, and he's extremely supportive, and we enjoy a good working relationship. I can confirm that. There is a question about the COVID billionaires and whether they approached me. No, I don't know who the COVID billionaires are. I was not buying. I was simply sending instructions to the procuring agency, and nobody has come to me asking me about the procurement. And I want to believe that whoever bought really was in contact with the procuring entity. But personally, I do not know who those are and whether indeed they exist. What about KEMSA writing directly to the National Treasury, and did they pay the 2 billion? Chair, I want to believe that KEMSA will be coming in to appear before you tomorrow, and they can confirm whether this payment was made. The board has been on this work, and Chair, as you realize, all these things have happened within a very short span of time. We are talking about March and now, just about 4 or 5 months. So I think even the fact that we were able to pick these things early is very indicative of the fact that we were on top of issues, and otherwise this is something that perhaps could not have emerged as quickly. And the board is well seized. Of course, when we received the communication from the National Treasury about the 5 billion, we alerted the board, and that is why they took up a quick audit to see how much had been spent, and I'm sure they can share that with the committee when they come. Again, the question of any instructions and who could have pushed or influenced, again, I have not been under any influence or any pressure. Really, I don't procure. This is done at the KEMSA, and they follow due process. But I'm sure they can justify the method that was applied for each and every of the consignments and commodities that were being procured. On the issue by Mheshimiwa Joyce, I believe, where she notes that there was a supplier called Klieg, and she's directly asking whether that was within the 758 million budget. I can state to you very categorically that Klieg is not among those suppliers, at least going by what has so far been paid. As you can see, our budget is 758 million, and going by the allegations out there, they may have had something like 4 billion. I do not know, but I'm aware that it is not within this, neither is that amount within the 7 billion that KEMSA spent on purchasing the commodities. So no monies were paid, because there's that feeling that there's a loss. As the CS said, we do not have actual loss of public funds. No payments, as I sit here, were made to Klieg. That is the information, at least I have, from KEMSA. Then there's a question about how much of the UHC fund was used for COVID. Again, we strictly apply funds for what they are intended. No funds have been used, to the best of my knowledge, but there's audits going on at KEMSA, and we will now be able to know, once the audits are done, whether UHC funds were in any way put into use for COVID. There's also some outstanding request from my office to KEMSA, asking them to give us an update on how the UHC funds have been utilized, as well as an internal audit that I've also asked to be done, just to know where we are. What funds are being extended and how much has anything got to do with COVID-19? I don't get this, but as I said, Chair, we submitted, when we came last to the House, to this committee, we submitted the entire budget and how it has been utilized and what balances remain and what is intended to be used for what. I have had this whole question about from Mheshimiwa Mohamud about my role as an accounting officer and the sagas. Indeed, yes, I have some responsibility, but the boards also have responsibility. And, Chair, we have seen many state corporations having challenges, and usually it is the management and the board that are put to task on what has happened there, because you would imagine the ministry has got almost 7 or 8 state corporations. Getting into the intimate details in there may be a challenge, but we work very closely with the alternate members of the board who represent the ministry, and at any time that there is an issue of concern, I would raise it with them, or sometimes even appear in person to address those concerns. There's a question from Mheshimiwa Captain Ruda about the letters and whether there's a record about them. These are official communication that can be authenticated. If you go to the delivery books and the receipt books at the various ministries and organizations, you will actually be able to track and confirm that these are valid communication. As I said, both World Bank and both the Auditor General recognize emails as official communication. And we also are very aware of the fact that we are under oath and we really cannot come to mislead the House deliberately. There's also the question about this approval for 1.5 billion. I think it was clear, yes, the AIE is strictly for matters of laboratory and related reagents and accessories. So that is a matter which I'm sure we will also be following up with KEMSA as we get their feedback on where they are with all the funds that have been transferred to them. Finally, There's a question from Mheshimiwa Jimmy Angwenyi as to whether the minister or the PS say when KEMSA, when the KEMSA asked for additional funding from the National Treasury, did the board know? I think what has come out is that the board had not given the approval for this, and it's still a matter that I'm sure the board is executing, and the investigations are ascertaining where the responsibilities lie and where the challenges could have arisen from. So again, we would wait for the outcome of the both the EACC investigation and also the outcome of the Auditor General to be able to know to what extent funds were utilized, perhaps with the knowledge or without the knowledge of the board. So I think I have answered all questions, and my CS had answered the other half of the questions from Mheshimiwa Jimmy Angwenyi. Thank you very much, Chair and honorable members.
Thank you. Unless we have members who would want to give some observations, concluding remarks, and I'll also be asking the CS also.
Yeah, Madam Chair, thank you very much.
So it's you. Let me start with Honorable Dagala, Vice Chair, because she has not spoken. Then I'll give it to you. Honorable Dagala.
Thank you, Chair. We've just had a long day. There's just some clarification I'll want maybe the Waziri to tell us. Because in fact, immediately after the expose of the COVID-19 millionaires, we find right now the curve is flattening. My concern is, are those testing kits really proper, or we are being not there? That is just my concern. I want to know whether those to the point, or they're just taking us in circles here and there.
Thank you, Honorable Kutuni. Members, we have to end this, so unless it's we have to finish. Honorable Kutuni.
Thank you, Madam Chair. Madam Chair, I've listened to the submission of both the Cabinet Secretary. We've gone through his document. I've also gone through the document of Madam PS. Madam PS, I think if you're a little bit, I'll not want to put it in a different way, but I want to say it came to your attention that there was a problem in KEMSA on July 2nd. And from here, there was a communication where you had realized. And that's why you wrote to CEO KEMSA that please note that the concern of the National Treasury that in future you should communicate, such a communication must go through the accounting officer, that is Ministry of Health. It must have come to your attention at that time. Of course, it came to your attention that there was a problem in KEMSA. But PS, from that time up to now, where we are dealing with this crisis, you had enough time to deal with this problem. From then, on 22nd, again, your letter was also, you are also raising a lot of concerns about over-expenditure. You went ahead in second, all these communication, 6th August, all the way, even to the last letter, this one for 11th, even 27th until the latest one, where you give detailed report. One thing is that you have shown that you are prudent in management, but then in decisiveness at the same time, because you've saved the public money that will have been utilized unnecessarily. What am I saying here? Is that the whole problem now that we have here is with KEMSA. You have your representative, you have a representative who sits in the board, who represents the PS. It is high time that you reprimand that person who sits in the board, who represents the PS, because this person should have informed you on time that there was a problem, and you should have also informed the same person. Madam PS, if this is what is going on in KEMSA, could you consider also doing an evaluation what is going on in other parastatals under the ministry? Because as a committee, we're going to open on this investigation, and we might be surprised that there is also this kind of communication and misunderstanding that is happening in these parastatals. So it is high time that you do some evaluation for the sake of the public. Lastly, Waziri, Kenyans, you must assure Kenyans, when are they going to get face mask? There is someone from Korokojo who's just texted saying, I am following it live. When are we going to get face masks? Another issue, people spend money. People borrowed money to purchase and to sell to KEMSA. These are Kenyans. Most of them are innocent. They've been trading in the market. Should we sit here as a committee and say, let them suffer? Or what is the government intervention? I bring it to your attention. If government doesn't intervene, we are talking of items worth 7 billion. If the government doesn't settle this thing as early as possible, and they go to court, it will come with cost. And we will be talking about paying around 30 to 50 billion. What is the urgent, such a situation where people will go to court demanding their payment? That is, I appreciate the responses that you've given us. Tomorrow we'll continue. Thank you, Madam Chair.
Chair, just a short comment before.
Thank you, gentlemen.
Very short.
We are almost getting to...
Very short, and that is...
and I'll give you 30 seconds. Just straight to the point, Honorable. Just straight, because we can't...
Number one, Chair, I urge...
Just 30 seconds.
I urge the committee, in the ministry, we are not a reactive oversighers. We mean well for this country, and we would like to have a working relationship, even if we take quarterly, so that we can also, give an idea. Lastly, the schools are being touted to be opened. If you ask me from my constituency, we are totally, because it will need a lot of testings, kids coming from all directions in this country. We want to have a statement from you, giving the surety of the health, safety, and prosperity and wellness of those kids. Thank you, Chair.
Thank you. Honorable Koros, just 30 seconds,
Thank you,
please.
Chair. Mine is just very, Bonawasiri and Madam PS. We have Director KEMRI seated behind you. What plans do you have for KEMRI? How much did you give to KEMRI for testing? Because we know KEMRI has the capacity of testing all the COVID cases. But it looks like you overshadowed KEMRI and you gave too much interest to KEMSA. What plans? Because KEMRI has capacity to do testing countrywide. Thank you.
What is out of order, Vice Chair?
Can I respond?
We know his background. And
Can I respond, Madam Chair?
So he might be knowing something about KEMRI that we don't. But it's appreciated. I think KEMRI also, we appreciate they appeared before this committee, and we were equally concerned as a committee when you are not their Vice Chair on the kind of support they have received from the ministry vis-a-vis what the expectations Kenyans have for KEMRI. I think it's good to note that what Honorable Koros has raised is a very important point.
And Chair, a quick one.
Enough.
Yeah, just a quick one on the same.
Enough. No.
So we need next time when we are meeting KEMRI, we also need the presence of either the PS or the CS so that we want to know the way forward.
For KEMRI?
Yes.
Thank you. I think CS, as we conclude, because we are doing our concluding remarks, I'd want you to
Madam
comment.
Chair, let me just be kind to Honorable.
To Honorable who?
Otherwise, I will have also asked him to declare his interest on KEMRI. But yes, I take it back. Thank you.
You've already asked him, so it's okay. CS, as you conclude, I think there was a mention by KEMSA, and they're coming back tomorrow, that they had written a letter to you indicating that they would want to be allowed to proceed with the sales of the merchandise that they procured or the commodities that is in store. And I would like you also give us your comments and your general feeling about that matter, because we'll be meeting KEMRI, and this committee will sit and make up and come up with a decision. But would like to hear from you. And at the same time, I think as you conclude also, your general view from what has transpired till now. Where does the buck stop?
Very well.
And where do you think we dropped the ball?
Thank you very much, Madam Chair. And I thank the members too for their very varied contributions. Let me start with the first question and respond to the matters of testing kits. And assure the honorable member that there are two, as I had explained earlier, there are the manual testing methods and the rapid and the automatic testing kits. There are also two other dimensions of testing. There is a rapid testing kit, which is been used some places in the world with very poor results. And there is also the PCR tests, which is exactly what we do here in Kenya. In fact, I would like to assure this House that we have saved a lot of money by refusing to buy rapid testing kits, which would have been giving us false readings. And I would like to assure you that if there is one thing that we have got in this country, particularly in our labs, in KEMRI, in the National Influenza Lab, what we have are extremely smart people, globally respected scientists who are better, or who are no less even better than those ones that you hear in Europe doing the tests. So I can assure you, if there is that, if the tests in Kenya are not good, the tests globally are not good. Our scientists are that good. The second thing that I also wanted to add in terms of, and I want to tie that question with a question regarding KEMRI asked by Honorable Koros. I think these are two very different institutions. KEMRI, and I'm glad that the CEO is here, so he can speak for himself, but let me just say this. KEMRI is one of our most respected institutions, and it is not just respected in Kenya, it is an institution that is globally respected in terms of its capacity, in terms of the people who work there. It is a very highly rated institution. We have two labs, essentially the National Influenza Lab and KEMRI. And those two labs are equally important to us. Isitoshe, when you look further, there are 33 testing centers now. KEMRI is the largest operation in terms of lab capacity that we have in this country. So you can't even begin to compare it with other institutions. It is a standalone offside institution that is large and country-wide spread. So there is no comparison really between KEMRI and other institutions, and or even worse. The only relationship between KEMSA and KEMRI is that KEMSA is a store for the reagents and other items that KEMRI uses. You know, and there are different institutions. One of them is a science-based research laboratories. The other one is a supply, is a procurement operation. So there are two completely different institutions. On the issue of the ministry, the representation of the ministry in KEMSA, yes. As you know very well, the act is clear that the PS is a member of that parastatal, and it is true that we change people from time to time who represent the PS in any ministry, but I will not speak to that for her. On the issue of face masks, again, that I think Honorable Kutuni has raised again, I think I had responded to that question. But I assure you, if there is one thing that I'm going to push everybody, and I'm glad that the chamber chair is coming here tomorrow, I think that going forward from here, we are going to instruct that those things be done immediately, and the orders be given immediately, because the orders have already been given. They were just waiting for the testing and the clarification of those ones. But I think they were also being careful, as I said, because I don't think that KEMSA wanted to be accused of that one as well. So I think the procurement process is finished, and the chamber is going to start manufacturing those things in the soonest possible time. And the PS is here, the PS and I are here, and we are going to take that responsibility to make sure it starts ASAP. On the issue of what do I think, Honorable Wino raised the matter of schools. We are working very hard with the CS Magoha to see the ways and means that we can be able to open the schools as soon as possible. But we are also alive to the fact that there are many countries where they have done the same. They have gone ahead, opened the schools, and then very quickly had to close because the infections just go up like, very, very, very high. And as PS Magoha has repeated over and over again, a dead child can't go to school. So let's get our priorities together. The first priority is to keep our children alive. And through them, because they are also, and they can also bring it to the parents. So the first priority is let's keep our children alive. School will come. School will come. And if you talk to most parents, that's what they are saying, tafadhali. And as for readiness, that is precisely part of the reason why, the idea of just sending kids to school when they are we haven't made the measures to do so, to open those schools, is totally irresponsible. And we cannot do that. On the issue of the Honorable Kotuni, on the issue of the payments, and I want to tie that up with what the chair has just asked. I think earlier on, I had said that we are not in the business of messing up business people. And I think that we all know very well. I get paid by taxes that come from business community, from the business community. We all, sitting in this house, get paid by the people who do business in Kenya. They are the ones who get taxed, and the government has money, and we get paid by them, by those taxes. So it would be folly for us to go ruining, the business people. So, Honorable Kutuni, I want to say that I sympathize with the business community. That is why I had said earlier, and Honorable Chair, I come back to what I had said. Let KEMSA sell. My view is that KEMSA must get rid of the stocks that they are holding. They cannot continue to wait for prices to improve because prices can get worse. And they must dispose those items immediately at the current prices so that they can be able to pay the suppliers who have supplied them genuinely. If there are questionable ones, those questionable ones can be put aside. But the genuine suppliers, I had one lady who came to me almost in tears, saying she's about to be sold because of she borrowed some money, supplied, now she can't pay. And the banks are on her case. So I agree with you that is something we need to do very quickly. But I think that the solution, even as we look for money, let us first of all say, let's sell whatever we have. Let's sell at the prices that are currently in the market, and then they use that money to pay the suppliers. In the meantime, as a ministry, what I can take from this house is for us to go and explore and see what else we can be able to do as a mitigating factor. Even as we wait for them to sell the items, is there anything we can do so that we at least don't keep people, don't get people being sold by the banks. So it is something that we will undertake to explore what we can do in the meantime so that we pay the genuine suppliers and the suppliers who have no issues and no cases going forward. So, Madam Chair, I don't know whether I have responded to the question that you have raised regarding way forward in that direction. We obviously wait for your report as well and recommendations. But as for me and as for the ministry, that is clearly a way forward that we can do almost with immediate effect. And I know that the KEMSA has made that request to my office. We have been examining it. Obviously, by the end of the day, what we decide will also need a cabinet approval because it is, after all, they are the shareholders of KEMSA. Moving forward, Madam Chair, I just want to say that it is important for us to appreciate that we have got issues that we have to deal with in terms of historical occurrences and historical facts. But I think that we must divide our time so that even as we deal with the past and even as we deal with what has transpired, we must remember that our children will live in the future. And we too have a future that we need to secure. And part of securing the future is securing universal health care. And so we will also be wanting to spend a lot of time, indeed more time, dealing with what is going to come, more time dealing with the reforms, and more time dealing with the possibilities of provision of proper health care to our people. That is what our minds are focused on, and that is what we are going to continue doing. I want to thank this House, and I want to thank the committee through you, Madam Chair, and continue, and hope that we will continue, to engage each other in such a fruitful and productive manner. I submit.
Thank you very much. Unless there's somebody with a comment. CS had asked a very simple question. Based on the whole story, what has kept us here from afternoon till now, what is your take on who dropped the ball?
Madam Chair, I think that I would not put it as one item. Mm-hmm. I think this is something that has been accumulating over a long time. I mean, the issues that we have raised today, some of them are immediate. Some of them have been there for, as I was saying, since 2018, when there was proposed reforms and so on. So it is not a single item. You cannot put it on a single item and say, this is the item that today. Perhaps the only word that you can summarize that would suffice to describe the situation is mismanagement. It was clear, and it is clear an issue of inefficiency. I think those are the two things, inefficiency and mismanagement, I would like to describe. And if there is something we are going to unravel, it is increase efficiency and improve management. I thank you.
Thank you, CS, and thank you, honorable members. Unless, Madam PS, do you want to give any remarks, closing remarks?
Just to really thank you, Chair, and honorable members. Asanteni for giving us a chance to appear before you.
Asante sana. KEMRI, you have been mentioned advancedly here, though you might not be comfortable speaking when your boss is here, but you can just say something. I think with the permission of your boss.
Thank you very much, Madam Chair. With the permission of my CS and PS, I just want to maybe say one thing. It is very clear from what the CS has said that we are working very closely with the ministry, and the testing has been going on fairly well. Of course, there are ups and downs. Often we run out of the kits, but of course, a lot of work has gone into that to make sure that the supplies are actually maintained. I know last Friday, we did receive a consignment. This was a donation from JICA of 50,000 kits. And this goes on actually to continue to support KEMRI in actually continuing with the testing process. Whatever the CS has said about KEMRI, these are great words about KEMRI. He's been very supportive, and I hope he will continue to support and the PS to support KEMRI as much as possible. Thank you very much.
Thank you so much, CEO KEMRI. Honorable members, anybody with a comment? If none, Vice Chair, do you have a comment? Professor?
Thank you very much, Chair. I really want to take this opportunity to thank the CS and the PS and the team for the very articulative presentations that you've made that has covered particular amount of pains that we as Kenyans had. And it is good that you have come out here to clear the positions that you are in, and the circumstances that did occur are the things that you have clearly aired. And I want to take this opportunity to say here, we are objectively here to discuss matters of importance to the Kenyans. And therefore, that objectivity is what I want you to go away with.
Thank you, Vice Chair. Do you have a comment or we conclude?
I don't have any comment to add on what we already has been said. We will continue asking hard questions. And also, we will give room for investigation to be done regarding all these issues. But we welcome the President directives that everything should go online for transparency purposes. But we hope on the issues of administration, Bwana CS, don't hesitate to take action. And lastly, Bwana CS, anytime you make announcement on COVID, ensure that also you communicate on matters that is touching on the ministry. You should not restrict yourself only to number of positive cases and the people who died. I think it is important. The problem here is communication. If you had communicated to the public about all these issues, we will not be here today. Thank you. Yeah.
Thank you. Mine is to, that's Captain?
Yes. Chair, mimi nataka tu niombe waziri. Nimeona ametembea kaunti nyingi, Lamu hajafika. Lamu pia ni Kenya, naomba uje, kuna shida nyingi huko. Thank you.
Thank you, Captain Ruwaida. Mine first and foremost is to thank the ministry through the leadership of the CS, PS and the team for coming and honoring our invitation, for the various insights you have given to this committee to help us coming up with our final report to table before the House. Gaps on your communication, CS, your ministry, if things are said out there and you don't comment or we don't get any information, then people start filling in the gaps. So as soon as an issue arises in the country regarding your ministry, I'd wish that you up your game on communication so that Kenyans are not left guessing on what happened. Secondly, clearly, CS, we will need reforms, KEMSA reforms. How we might be engaging you further, but clearly ICT must be adopted in KEMSA so that there's transparency and we can also support the directive from the President. We'll also be working on to see the issue of distribution. Maybe we'll be asking you, and the big question is, are we saying all our counties have these PPEs or are there gaps? How do we feel in the 47 counties? Even before we think on selling, could we then first cushion our health workers and see how we can be able to work out on distribution and also on this payment? I think clear policy direction on KEMSA need to be there. Finally, I want to honor one of our own, Honorable Dwale. You all caught us by surprise. And thank you for being the first member of parliament to actually declare that we had COVID. You know, maybe we hear some of our colleagues had COVID, but we've not seen anyone who is brave enough to say that we had COVID and actually being in the hospital for those over 40 days. It has shocked me as your chair. So we thank God for you. We thank God for your for being brave and even giving you an idea to fight COVID. So you are a fighter and a warrior, and we welcome you back to our committee. And thank you. Continue telling people out there, because sometimes I feel bad when I hear people at our level and capacity saying that maybe COVID is not there. It's being created for people to make money. At least we have somebody who has gone through it and who is a witness that COVID is there. As we do our investigation and oversight, let's be careful so that we actually don't mislead Kenyans, and we try and work together with the government. And as being the people's representative in this house, we will ensure that what we give CS to your ministry, it is utilized to the best. And if there's anybody who will have to be held responsible, we will not shy away from doing the recommendation. So we thank you. Thank you for putting up for many, many hours. May God bless you. Enjoy your evening and continue serving Kenyans. Asanteni. Honorable members, we might not sit back, so we'll meet again tomorrow 9, because we expect to start 9:30, and we'll have a lengthy day again tomorrow. So thank you. 9 it is tomorrow.